tonight. My name is Andy Eisen. I'm running for Assembly District 21. In the course of answering why I'm running for the Assembly, I think it's easiest just to tell you a little bit about me. I think it then explains pretty well why I've decided to run. I am a native Southern Nevadan, born and raised right here in Clark County, born at Women's Hospital, may it rest in peace. And I am a product of Clark County Public Schools, kindergarten through 12th grade here, graduated from Chaparral High School. And when I graduated from high school, I knew I wanted to go into medicine. I was concerned about the medical education that I could get in Nevada at that time, and opted to leave the state. I went to Northwestern University's honors program in medical education. And after that, after I got my bachelor's of science in medicine and my doctorate in medicine from Northwestern, knew that I wanted to train in pediatrics and didn't have the option to do that here in Nevada. There was no pediatric residency training program in Nevada at that time. So I got about as close as I could, did my residency and chief residency in pediatrics at Phoenix Children's Hospital, Maricopa Medical Center in Phoenix, Arizona. And then it was time to come back home. My wife, now 20 years, when she was my girlfriend, sent me a refrigerator magnet that has a silhouette of a showgirl on it, and it says, "As soon as this is all over, I'm going to Las Vegas." And that refrigerator magnet is still on our refrigerator today. This has always been home. Diane was raised here as well, and we knew we were coming back here. Well, when I finished my residency, I thought it was time to put my money where my mouth was. Like I said, I left the state because I was concerned about the medical education I could get here. I didn't do my residency here because I didn't have the choice. So I went to work for the University of Nevada School of Medicine as an assistant professor of pediatrics and the associate director of the then brand new pediatric residency program. Spent a few years in that position and was promoted to director of the residency. Spent another about 6.5 years working for the University of Nevada School of Medicine in that capacity. And then the opportunity arose to come over to Touro University, Nevada, here in Henderson, and take the position as the Associate Dean for Clinical Education, responsible for the 3rd and 4th year experience for medical students when they actually leave the campus and go out into the real world and see real patients alongside licensed physicians to finish their general medical training. I thought that was an important thing for me to do. You hear people talk all the time about where we rank in terms of healthcare and in terms of education. Neither of those tends to be good things that we hear. 10 years ago, the state of Nevada didn't rank so well in terms of how many medical students we were training. The national average is 30 medical students for every 100,000 population, and in Nevada that number was 9. Thanks to what we've been able to accomplish right here in Henderson at Touro, that number in Nevada is now 29. It's made a huge difference being able to train medical students right here in Southern Nevada, and creating an opportunity for people to do what I wasn't able to do not that long. I'm not that old, so only about 25 years ago I didn't have that choice. I have practiced clinical medicine as well in those positions. I've provided clinical care to sick kids on the inpatient service at University Medical Center. I've been on staff at UMC in Sunrise for almost 15 years now. I'm currently the medical director for our Center for Autism and Developmental Disabilities out at Touro. And I continue to provide some volunteer medical services at the school-based health clinic at Basic High School and also at the Helping Kids Clinic, which is down near Commercial Center. My wife, as I said, also grew up here, also a Clark County Public School graduate, graduated from Chaparral High School. She did the same thing I did, left the state to go to college because she couldn't train in physical therapy in Nevada at that time. We now have 2 programs in physical therapy in the state, but she had to leave and go to Cal State Long Beach and came back. We have 2 children. Our older one is 18, graduated last year from Silverado High School with honors. I'm very proud. And he is currently a freshman at Northern Arizona University, studying computer information systems, and your younger son is 13, and he is in 7th grade at Sylvester Junior High. I've really spent my life trying to give back to my state, to make it a better place to live, to improve educational opportunities, to improve the quality of medical care and the access to health care. I've spent a good part of my time advocating on behalf of people who cannot speak for themselves, for children, particularly those who have been abused and neglected. I've served on a number of child abuse teams. I've served for 10 years on the Clark County Child Death Review Team. We look through every death of every child under 18 in the county. Each month, the multidisciplinary team meets together to come up with prevention strategies for how we can decrease risks in the future. That's really what my life has been about, and the opportunity arose to run for the Assembly when the lines were redrawn and the incumbent was Mark Sherwood, and I was more than happy to see Mark Sherwood not run again but I would have been more than happy to run against Mark Sherwood, quite frankly. But it was a natural extension of what I had done, an opportunity now to advocate for an even broader group of constituents across a broader range of issues. So thank you very much for the opportunity to meet you all. I guess we'll take some turns here and then answer some questions.
Thank you.